Here I am going to discuss about some of the important clinical disorder related to respiratory system, and these are the different respiratory disorder or the important respiratory disorder which are related to our respiratory system. I will go one by one. Okay, so first come to the emphysema. Emphysema, this is the one of the important disorder and which is related with the damage of alveolar wall. Alveolar wall damaged because of the sustained irritation of respiratory organs due to smoking or air pollution or industrial dust or different cause may damage the alveolar wall. So because of the damaging of the alveolar wall, which causes the partial distension of alveolar wall. So partial distension of alveolar wall which damaging the respiratory membrane at the time of expanding and which reduces the respiratory wall blood level oxygen also, and mild exercise causes hard breathing. So this condition is known as the emphysema. Actually, very simply you can say emphysema means the damaging of alveolar wall because of the smoking or the air pollution or the industrial dust or the sustained irritation of respiratory organs. Okay, to the another disorder, this is the bronchitis. Bronchitis, which is related to the bronchioles. Here, the excess growth of the goblet cell or the excess secretion of goblet cell causes and which form a thick mucus layer around the bronchioles and which reduce the process of breathing or inspiration and the expiration, and which also causes the painful respiration. So and here the smoking is the main reason of the bronchitis. Now come to the another disorder which is the asthma. So asthma, this is the chronic inflammatory disorder in which the air partially or completely constrict sporadically. Okay, so suppose that you can see here, this is the normal bronchioles and this is the bronchioles of the patient asthma patient here, and here there is the swollen or the excess mucus growth inside the bronchioles. Okay, so due to sustained contraction of the smooth muscles in the wall of smaller bronchi and bronchioles causes difficult and noisy breathing and periodic coughing. Causative agents are allergic like dust, pollen, etc. Emotional upset and certain drug also causes asthma. Okay. So there are the different agents or the cause which are responsible for the causing of the asthma. Now come to the another disorder which is the rhinitis. So most of you have experience about the rhinitis. So rhinitis, this is the very simple acute or the chronic inflammation of the nose mucous membrane. Okay, so this is the rhinitis, and another condition is the epistaxis or the nose bleeding. Okay, so nose bleeding, there is no certain reason but loss of blood from the nose due to allergy condition or the infection or the malignant growth or injury or emotional shock which causes the bleeding of the nose. This is known as the epistaxis. Another disorder is the asphyxia. Asphyxia. Asphyxia, this is the oxygenation starvation. If the oxygen level in air goes down, then the starvation of oxygen which causes the asphyxia. Another disorder is the aspiration. Aspiration, the entrance of some foreign substances like food, water, or other materials into the bronchial tree, and which causes the aspiration. So here, this is the path of the stomach, but sometimes the food or water it may enter into lungs through the trachea, and which causes the aspiration. Another cause another disorder is the common cold or coryza. Coryza, so caused by the viral infection of the nasal mucosa, and everyone have a experience of the common cold. So symptoms include sneezing, excessive nasal secretion, congestion, and cough. Acute cold may cause fever, bronchitis, asthma, sinusitis, laryngitis, etc. Okay, now come to the another disorder, influenza, or you can say this is the flu. So viral disease of respiratory system, systemized by the high fever, chills, headache, etc. So the common cold and influenza slightly common. The symptoms are slightly common here. Okay. So now another important disorder is the pneumonia. Okay, pneumonia means if the alveoli filled with fluid, then which is known as the pneumonia. So condition of acute infection or inflammation of the lungs alveoli. Alveoli fill with fluid and cell derbies, which causes or which is known as the pneumonia. Oxygen intake is drastically reduced. Most common causative agent is pneumococcal bacterium, streptococcus, and pneumoniae. But there are several cause and several agents which also cause the pneumonia. So viral infection, protozoan infection, and any other foreign matter also cause the pneumonia. Okay, so simply you can say if the alveoli filled with fluid or the cell derbies, then this is known as the pneumonic condition. Okay, now come to the another important disorder which is known as the tuberculosis. Actually it is caused by the bacterium, and the bacterium, the scientific name is the mycobacterium tuberculosis. That's why this is known as the tuberculosis. Okay, and lungs tissues are destroyed and replaced by inelastic fibrous connective tissue here. Okay, that's why breathing and gaseous exchange in lungs are seriously affected, and this condition is known as the tuberculosis. So thank you for watching. So that's all.